Morning.
Hi,
Thank you
Doctor.
for having me.
Yeah, thanks for joining us. So, Dr. Erni, what do we know so far about the Omicron variant in Indonesia?
Yes, so this is the latest variants that been first discovered in Africa. But since the virus might then spread to all over places, so now in Indonesia, we also start to diagnose people with this variant. So as reported by the Ministry of Health in 24th of January 2022, more than 1,500 cases of Omicron already been identified in Indonesia.
All right, Dr. Erni. So let's look at some of the myths that people understand about the Omicron variant. They say that it is not as bad as the Delta variant that we saw, and that it only affects our lungs. Instead, it doesn't infect our lung, but it infects our respiratory system. How true is this understanding?
Yeah, first we have to understand that this is still the same viruses that we've been known since the last 2 years. So this is not the new virus that will be act totally different.
Right.
What we have to understand that the virus is infect humans through the respiratory tract infection. It's correct. But then whether it will goes to your deeper lung and causing shortness of breath or a more sicker condition, it is not merely only due to the virus itself, but it's also involved the immune system of the persons. Of course, we can learn from the data among those that already been infected with Omicron, how severe it can infect people. But then it's really like, we cannot be simplified said that this will be only stay in your upper respiratory tract infection and causing no damage in other side of your body, because when it infects different hosts, different people, then the spread of the virus in the body, the outcome of the disease between persons will completely something different.
Right.
You cannot say that, yeah, so we cannot say or simplify this, that this will be just mild, so don't worry. So if you have it, then it will just stay in your respiratory tract infection.
Right.
I'm not sure we can do that, because we also heard that people experiencing severe condition, even that also already been reported due to
That's
the
right.
Omicron. So, yeah.
Which just shows the danger of the Omicron variant.
Absolutely. I mean, it's still COVID.
That's right.
It's still coronavirus. So Indonesians are gradually receiving the booster shots or the third shot, Doctor. The government is making it easy for the public to access the third shot. That is very, very important in giving extra protection against COVID. So could you please explain to us how much protection or how effective does a third shot of COVID vaccine in protecting us from Omicron?
Okay, so the vaccination itself, the thing is we have to understand that when the vaccine is generated, it will stimulate your antibody. And then this antibody will respond to the virus, not in only specific protein. What I mean here that we might have different variants of SARS-CoV-2 viruses. Then the antibody that generated by the virus will not act only for certain kind of strain. So if you ask me whether the booster vaccination will then be protect people from getting COVID-19, the answer will be yes. But then how will effective this protection? We still need to see data after the vaccination. So this is not something easy to say it in the beginning. Like for example, when we have the data in Indonesia showing that how high is the antibody generated after the vaccination. 2 booster vaccines, the government program, and then another shot for the healthcare workers at that time, the third vaccination, then we can see that the antibody is like getting higher after the booster from the healthcare workers. So what I'm going to say here that the booster that planned from the government will absolutely give higher protection or higher level or antibody for the persons. Then, of course, since we know that the vaccine is not generated for certain variants, so this will be inshallah also cover the Omicron. But to see how effective it is, I think this is the surveillance data that we need to collect among how many vaccination already been given to the people and how many new cases actually diagnosed after these terms. So we can see that whether it really works or not. And I also need to mention here that it is not only Omicron's variants that been in the air at this moment. As we can learn also from the United States and from the UK data, they have almost all strains still available. But of course, the proportion will be different. But it is not like when they have one strain, then the other will be like 100% disappear. That is not the case. Yes, we also learned the same situation with dengue virus, for example. We have 4 different strains, and all these 4 different strains can be circulated at the same time with the different proportion between time. So remember, we might still have Delta. We now have also Omicron. So please do your PPE, personal protection equipments with, the right way and still be,
and the right health protocols.
Will do, doctor.
Correct.
That's right.
We're still wearing masks now.
That's very well noted, doctor.
Hand sanitizer everywhere in the studio.
Everywhere, yeah. All right, doctor, so we've been through a big wave during the Delta. We had the restrictions like the PPKM level 4 that halted everybody. The difference this year is we're going to have some big international events such as the MotoGP in March and the G20 as well. Will restrictions that we did when we did the Delta wave, will that be enough to curb this wave if it comes?
What we learn with Omicron is it is easily spread, but maybe as the virus itself, it is not that severely attack the person. If we only look at the virus. So then, hopefully if we can stick, we already learned from the hard one, when the Delta pandemic a few months ago. So if we can keep the protocols, increase the vaccination coverage, and we make sure that people with the higher risk of getting severe infection where they contracted to the disease have more awareness to this, like prioritizing their vaccination and then, limit the mobilization within this person. So you have to generate a certain, because I'm not sure whether the pandemic will be soon over too, because we still don't know. We still don't know. So we need to improve the protocol, the health protocol that we already have, improve it, and please comply to it better. And then in another side, we also already have vaccination to protect, to give active protection within person. But then for certain group of people, please aware that you are special, so you need to do something more, different.
Okay.
Yes, you mentioned also that we have to improve the way we protect ourselves still in the face of the virus. So there is this bubble system for those who want to hold events. For example, very recently, doctor, I had an event So the people who attended the event, they had to have the screening, the antigen test. Or we had to quarantine somewhere, and we're not allowed to go home because we're going to be in that certain event for a certain period of time. So let's just quarantine ourselves together. We stick together, so we're healthy together. Do you think those measures are enough so that events, especially big events in Indonesia, can still go on safely for everyone?
Yeah, I think what important is not at the first set this is this enough or not, but first how we can comply to this, to all to the program that already being created, because it's involve people and it's involve mass of big number of people, whether they are all can comply to it, and then how the mitigation or if something happened afterwards, someone reported, suddenly someone got symptoms of sore throat or something, how can the committee mitigate this situation promptly? So then, you have to, you screen people at that time. Maybe everybody is healthy, but the next day you don't know. Because you don't know that all these people been together from different places beforehand.
All right.
And they might be, exposed with different kind of situations. So then everybody needs to be honest if they have sign and symptom and report it to the committee that already been established, of course. And then they really have to know what they should do.
Right.
Yeah.
It is not like make things become complicated, but then what you need now is you should know what to do if this happen, this happen, this happen. So this is the preventive measurement that needs to be programmed. We are in a special situation now. We cannot of course, get worried all the time.
Yes.
But then not doing anything. They're not doing anything.
Panicking.
It can't be like that. Yeah.
All right.
But then we start to making a big event, generating events or whatever. It's of course possible, but then the committee needs to have all these mechanism.
Right.
Yeah, and they have to be strict
To
about
react.
it.
Very strict.
Yeah.
Yes, correct.
That's right. All right, Doctor. So we have a couple of questions from our citizens here that they would like to ask you. We'll put it up very soon.
Yeah.
All right. The first question is from @Vesranda.
Yeah.
Is it true that lower back pain is a symptom of Omicron?
Really?
Is it true, Doctor?
Yeah. The virus have receptors in almost all over the body, but in the learning from the Delta pandemic back then, the Delta strain, maybe less than 1% reported back pain. So this is not the common.
Right.
This is not the common symptoms.
It's uncommon but plausible.
But plausible. It's uncommon,
Yes.
but plausible. Okay, the second question is from @Farelinat. Will a high dose of vitamin D and C above 5,000 IU help prevent COVID-19 infection? Or will it cause a negative impact on our bodies?
Vitamin has no direct effect for the virus. If you expect it to act as an antivirus, the answer is no. But vitamin can improve the function of your cells, including immune cells. So from this mechanism, indirectly, it will help you to protect you for easily sick because of if you expose to the small number of virus, any kind of virus, then your immune cells is function much better. If you consume vitamin and antioxidants, because these things contribute to the function, to the process of making the cell in the body. and and that's how it works. And how about consuming more than the body needs? Vitamins will be excreted when your body have it more. For example, you take so high vitamin C dosages, then your urine will be colored with the vitamin. Because it will be excreted.
I see.
So then I think it's better to take the number that we recommended daily for the vitamins to take. For vitamin C, normally we need not more than 100 milligram actually. So if you already take 500 milligram, it's already 5 times higher than the recommended dosage. Yes.
Okay.
So that's already enough. Okay.
Right, yes.
All right. Thank you very much, Doctor, for dispelling many of the myths on the Omicron virus. Please stay safe and do enjoy your day.
Thank you. You both too.
Thank you, Doctor. Have a nice day. Bye.